There's a few medications that cause swelling that are notorious for this, but one of the medications that always comes to mind is a medication that I have often prescribed for blood pressure called Amlodipine. This might sound familiar to you. You might be on Amlodipine. Great medication, not a problem with it, but one of the potential side effects is swelling. And my patients over the years who have gotten swelling from Amlodipine complain of swelling in their lower legs or their ankles, their feet, etc. So that is one medication that if I'm planning to start it on someone, I have to tell them, hey, this could cause swelling. Now, there are other medications that can cause swelling too, but that's kind of what we're talking about. Not just the medications, but in general, the things that can cause swelling in your lower extremities, your ankles, your feet, your lower legs, okay? And there's many different things, meds just being one of them. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. All right, so let's also talk about the weather, all right? When the weather gets warm, honestly, I want to know, write in the comments, when the weather gets warm, how many of you feel that like your legs or your ankles or your feet swell more than usual? That happens to a lot of us, and a lot of my patients notoriously have swelling when it gets hot outside or when they're outside in the heat. That's not uncommon because when it's hot, lots of things, blood vessels will start to dilate or sort of, open up, and that can cause excess fluid. When we're talking about swelling, we're really talking about the medical term edema, which means that there's excess fluid in the tissues, but it can happen for a number of reasons. That's what we're talking about today. So we've gone through medications. Sometimes the heat can do it. Let's also talk about our diet, y'all, because I know, maybe you know, but I know that if I eat a whole bag of potato chips or something super, super salty, I'm going to feel swollen the next day, okay? You might feel that way too. Food can actually be a big sort of contributor to us feeling like we've got extra swelling, edema, fluid in our tissues. There's also other things, being premenstrual, being menstrual, being on our period. Sometimes we feel bloated, we feel swollen, and also pregnancy. Oh my gosh. I mean, many of the staff people and friends and family of mine that have been pregnant, one of the things that they complain about or have commented about, as I know you know, is swollen ankles and feet. And sometimes you can swell a lot. Write in the comments if that was or is or has been you in the past when you've been pregnant. There are a few other things I can do. Oh, by the way, let's go back to the medications for another moment because I only mentioned Amlodipine, which is a blood pressure medication, but there are plenty other meds. Steroids can do it, okay? Oh, totally notorious for causing swelling. NSAIDs, non-steroidal anti-inflammatory medications, things like ibuprofen, etc. Estrogens can do it, and other medications as well. Now, let's move on to some other causes of swelling, right? So those are a few things. Sometimes even like being stationary and not moving a lot can contribute to swelling, but sometimes there are what we call systemic causes of swelling, meaning there are other reasons, meaning there's something going on in another part of your body that's contributing to the swelling that you experience in your lower extremities, such as congestive heart failure. That is important and potentially very serious, or something like liver cirrhosis, that's damage to the liver, or even kidney disease. There are many different what we call systemic conditions that can cause swelling in the lower extremities. Also, lymphedema. I know I did a video on lymphedema. This is basically when the body's lymphatic system is not working to return blood and it's not doing its job the way it's supposed to, and fluid sort of gets pushed out into the tissues as a result of the dysfunctional lymphatic system. This is a sort of a systemic condition because we know that people with lymphedema can get swelling not just in their lower extremities, which is what we're focusing on here today, but they can get it all over the body, okay? So that's important to keep in mind. Also, if you've ever had lymph nodes removed or had surgery in a part of your body, that could contribute to swelling as well. Now, there's some other things that I think are not as common. People with a protein deficiency. It's sort of a I don't want to say it's complicated, but proteins help regulate a lot of stuff, but they also can play a role in fluid as well, believe it or not. So those people with protein deficiencies, and I would be remiss though if I mentioned something that I think a lot of my patients worry about when they come in to be talking about swelling. They're worried about blood clots in their lower extremities. Now, lower extremity swelling for some people could indicate the possibility of a DVT or a deep vein thrombosis or a lower extremity blood clot. I mentioned this just to mention the wide range of things that could be contributing or causing your lower extremity swelling. And you guys know I always do these videos and I tell you this video and this information is not for you to diagnose which one you have. It's not for you to say, aha, let me think which one of what she described is why I'm swelling. It's to let you know the range and have you go see your doctor so you and your doctor can help decide what's the cause. Because guys, the cause of the lower extremity swelling, the cause of your ankle swelling, your foot swelling, your leg swelling, the cause of that is going to help determine the treatment. The treatment could be as simple as, leg elevation, lifting your legs up and elevating them. Could be as simple as compression or compression hose. Could be as simple as, minimizing salt in your diet, getting more activity, massage. Or it could be way more complicated than that if it's something more systemic or a blood clot or something else, okay? And I'm not implying that all of the types of swelling that's caused by the conditions I mentioned are the same. That's not the case. Oftentimes when we see blood clots, we don't usually see them in both legs. I say don't usually, okay? But that's something we keep in mind. Sometimes though, when it's something like hot weather, people will have swelling in both legs. Or if it's due to amlodipine or medications, it may be both legs. But this is not a hard and fast because everybody's a little different, okay? So don't y'all be diagnosing yourself. But what I'm saying, as I've said before, is get this checked out. No, I should also say too, swelling, that was not intended. Swelling can actually be a big deal. Now, I know sometimes people may blow it off and say, oh, it's just a little bit of swelling or a little bit of edema, but this is the thing. Swelling in our lower extremities, our ankles, our feet, our lower legs can be painful. It can, because what happens is when you have excess fluid, our skin can literally get tight with the extra fluid in there, and it can become very tight and painful. Patients will literally say, it feels so tight. Sometimes we may be able to see like a little dimple when we push our finger into the skin, showing that we have that much fluid. It can be uncomfortable. It can become itchy. Oh, and another condition that's very, very common with people that, I don't know if I mentioned this or not, but it's called chronic venous insufficiency. This is a huge cause of swelling that I see in many of my patients, where basically the valves within our veins they just start not working right. They get floppy, they get lazy, whatever, and they don't do a good job of kind of moving the blood along, and so blood starts to pool. This is not an uncommon cause of lower extremity edema or swelling. But just know, look, if you have this, number one, you're not alone. Number two, it is important because it can be uncomfortable. And I've seen people with swelling so badly that they can't fit into their shoes. And remember, all types of swelling, we need to figure out what the cause is, because there are some potentially dangerous or deadly causes. I mentioned DVTs. Also, the more systemic causes, if it's due to kidney disease or liver disease or congestive heart failure, that is super important. So let your healthcare provider and professional help you decide what's going on so you can get proper treatment. Most important thing is that you get seen by someone right away. Guys, I want to know, do you have swelling? Is this something you've dealt with? What's your swelling due to? What do you do? I always ask you guys to comment because often what you say helps other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this video was helpful. Let me know in the comments. For those of you on Facebook, please like and follow my page. Also, for those of you who send stars, I respond personally. And consider joining my subscription groups on Facebook. For those of you on YouTube, please subscribe to my channel and click the little bell for updates. And by the way, guys, check out my website, drjencaudle.com. I have a new health update that goes to your inbox and your email every single day for those who subscribe. It's called Dr. Jen's Health Update, as well as other things, my blog, etc. So come to drjencaudle.com. Guys, I hope this is helpful. I'll see you soon.